The following video is to review current pre-hospital airway management devices and introduce the field to the LMA. The bag valve mask, or BVM, is the fundamental device and skill for field airway management for both paramedics and EMTs. It is critical that all personnel are proficient in utilizing the BVM in both adult and pediatric patients. Prolonged BVM ventilation during the pre-hospital management of a critical patient can be difficult. It requires the reestablishment and maintenance of a mask-to-face seal with each movement of the patient. In addition to the BVM, airway management options for an adult include the laryngeal tube, also known as the King tube or King LT, and endotracheal intubation with either direct or video laryngoscopy. In the Santa Clara County protocols, there is currently no alternative to the BVM for ventilating pediatrics that fall below the maximum length when using the length-based weight estimate tape. In efforts to provide Santa Clara County paramedics an additional option in airway management for adults and pediatrics, the laryngeal mask airway is being added. The LMA is a perilaryngeal airway adjunct that places an inflatable cuff around the larynx and above the glottic opening. The perilaryngeal cuff seals off the airway with counterpressure against the posterior pharynx. The perilaryngeal cuff seal is operationally similar to an endotracheal tube cuff seal. It isolates the airway from the esophagus. The LMA should not be used on patients with upper airway edema. Santa Clara County is incorporating the LMA for three main reasons. Adding the LMA provides paramedics an airway management option for pediatric patients other than the BVM with a BLS airway. The LMA will also replace the King LT as an alternative to endotracheal intubation in adults. There are limited studies on airway physiology using the King LT, especially in pediatrics, yet there is decades of experience with the laryngeal mask airways. Due to these reasons, the LMA is being added as an airway management device for paramedics in Santa Clara County. The LMA Supreme is a version of the LMA that has a semi-rigid ventilation tube with integrated bite block and fixation tab, a perilaryngeal cuff that support higher peak airway pressures, a cuff design that partially occludes the upper esophageal sphincter, and a gastric contents decompression tube. The following video is a demonstration of the proper insertion using the LMA Supreme. Begin by choosing the LMA size based upon the patient weight. After firmly connecting a syringe of at least 50 milliliters to the inflation port, hold the syringe and the LMA Supreme and deflate the cuff. Lubricate the posterior surface of the mask and airway tube just prior to insertion. The patient should be in the sniff position with head extension and neck flexion, or neutral position with chin lift for suspected cervical spine injury. Advance the LMA into the mouth, maintaining gentle upward pressure against the hard palate and along the natural curvature of the airway. Resistance will be felt when the device seats against the upper esophageal sphincter. Secure the LMA to the patient's face using adhesive tape. Use a piece of adhesive tape holding horizontally at both ends. Press the adhesive tape transversely across the fixation tab, continuing to press downward so that the ends of the tape adhere to each of the patient's cheeks, and the device itself is gently pressed inwards by the tape. Without touching the device, inflate the cuff with the volume of air specific to the airway size or until the pilot balloon feels firm. Ventilate the patient listening for air leak, feeling the bag valve compliance, and watching for chest rise and EtCO2 waveform. Let's review the insertion sequence. First, choose the LMA size based upon patient weight. Size 4 will fit most adults. Next, deflate the cuff. Lubricate posterior surface of the LMA. Ensure the head is in the proper position and advance the LMA into the mouth, maintaining a gentle upward pressure against the hard palate, following the curvature of the airway until resistance is felt when the device seats against the upper esophageal sphincter. Tape the device in place. Inflate the cuff with the volume of air specific to the airway size or until the pilot balloon feels firm. Ventilate the patient, listening for air leak, feeling for bag valve compliance, and watching for chest rise and ETCO2 waveform. If you have any questions about the LMA or use of the LMA, please contact the EMS agency at the email address listed here.